Welcome everybody to the we are in November, yes, 2025 National Urban League Health Equity webinar series. And we're really excited today to have a conversation about caring for caregivers. I'm Lydia Isaac. I'm the Vice President for Health Equity and Policy here at the National Urban League. And I am so honored and really humbled to be joined by this wonderful panel of beautiful women who are going to talk about and for us to have a conversation about caregiving and how do we care for our caregivers. And so I'm going to have each of our panelists introduce themselves, and then we're going to get into the conversation. And I'm going to actually start with Miss Jessica Guthrie.
Hello, everyone. My name is Jessica C. Guthrie, and I am the full-time caregiver of my mother, Constance, as she has been living with Alzheimer's disease for the last 11 years. So I have been her full-time caregiver as well as balancing working full-time. I've been both a long-distance caregiver and also someone who now lives at home caring for her in her home. When I'm not caregiving, I am also working with companies and organizations to bridge the gap between the reality of the family caregiver experience and the products and systems and services that they're creating for us to ensure that we are at the center and that we can thrive on our caregiving journeys. And so I'm just really excited to be here to share a little bit of insight into who I am and how I've been caring for my mom the last 11 years.
Wonderful. Dr. Karen Moss.
Good afternoon now, and thank you so much for having me. And thank you so much, Jessica, for all that you do in caring for your mom. I am a registered nurse by training, and I am an associate professor of nursing, tenured at The Ohio State University. I am an advocate for dementia and dementia caregiving. I have been in this space for more than 10 years now in the work that I do on the academic and research side, but as a nurse for 25 years, also caring for people living with dementia professionally. And through my work, have developed a program that supports particularly Black dementia family caregivers who are in the midst of caregiving, and also the former caregivers as well, which I hope to be able to share about a little later. Thank you so much.
Fantastic. And Miss Rita Choula.
Yes, hello everyone. I'm so happy to be here with Jessica and Dr. Moss. Really appreciate this opportunity to have this conversation. I am the Senior Director of Caregiving in the AARP Public Policy Institute. I've worked at AARP for over 15 years now, and it coincide, or shall I say, intertwined with my role as a full-time caregiver while working for my mother who lived with frontotemporal dementia, FTD. And I did that at least for 8 of those years while being sandwiched, caring for my 2 young children as well. And really, when I look at my work and what I am very fortunate to do every day, it really is about, for me, bridging policy and research to practice. I think so often when we talk about caregiving work, we look at the work in silos and we don't really take a close look at how all of these things need to work together to support the whole caregiver. And really, this work needs to be focused on the lived experience of that caregiver. So I really look forward to this conversation and to hearing questions from you all as well.
Fantastic. Thank you. As you see, y'all, I told you we had a fantastic panel of wonderful people. And so I want to start us off really kind of simply with defining caregiving, because I think that people think of caregiving as something very specific. And I want us to talk about the broader landscape of caregiving. And Rita, as you just said, about how it impacts all aspects of people's lives. So whoever wants to take that first, can we just define caregiving?
I can jump in. I think when we talk about caregiving, and that's the challenge right there, right? That we have to define the word caregiver, which is the why so many individuals don't see them in that role. But I know when we talk about it at AARP and in our research and in policy conversations, it's not necessarily just the blood relative, right? It's not just the kin in the sense of a daughter or a child or a grandparent, etc. It really is whoever is in that universe of care. So it could be a neighbor, it could be somebody that goes to church with you, it could be a good friend of the family. It's someone that has said, yes, I am providing this care for you in whatever way that you need. And that's how we define it. But it's difficult because we do tend to use the word caregiver, which I think is very important to use a word, especially when we're talking in professional audiences, when we're talking with healthcare providers, etc. But that's how we define it.
Can I build on that, Lydia? I would also say, as someone, so I became a caregiver at the age of 26. And when I talk to other family caregivers, they often are like, well, I'm just being a good daughter. I'm just being a good son, or I'm just being a good grandchild. And it's like, I'm just ordering groceries, or I'm just organizing. And it's like, you're just things that you're doing are actually actions of care for someone else. And we often don't take on the title because we think it has to look a certain way. But like caregiving is truly saying, I am going to take on the act of thinking through what someone else might need, right? Whether it's organizing a pantry, organizing medications or appointments, right? Those are acts of caregivers. And I often share that because so often we don't take on the title, which then means we don't get resources, supports, and or people just don't see us when it's like, oh no, we're doing very big strategic things for our loved ones, and we deserve to be seen in calling it what it is.
And if I may jump in, thank you so much, my co-panelists. You all hit it right on the head. I wanted to maybe step back a little bit because what I find, particularly in the professional space on the healthcare side, oftentimes we use the term caregiver very loosely, and some people tend to think that it means the healthcare provider. So yes, that's a caregiver in the sense, but I think what we're talking about here is more, as you all have described, is the caregiving by that in a more informal sense, right? So by that loved one, by that neighbor, by that friend, family member, and all down that list. Um, Oftentimes we refer to that as being more of an informal, and sometimes we used to say unpaid, but no, we want those caregivers, those types of caregivers to receive compensation too, because we know about the lack of the ability to show up in their professional spaces and earn money that way. So they have to take a step back. And so we want those caregivers who are doing it, the family caregivers, to be able to be compensated for what they do, but also recognizing that oftentimes there's the professional caregiver who is the nurse's aide or the nurse or the doctor. That is very different from, I think, what we're talking about here today. So just wanted to clear the air on that piece of it.
No, Dr. Moss, thank you for that because I think that's a really good point. Many people have, because of whatever stage they are in, whether it's aging or if they have some kind of medical condition where they need, 24-hour care, or they need someone to come in, and that usually is a professional person who, through a, some kind of temp agency, home health agency that helps them, which is a different type of caregiver, which is also a caregiver, right? They're a paid caregiver, but they're still a caregiver, and they also need to be taken care of in this kind of place. So there's also a workforce issue that we're talking about here. And I love that we made that distinction because I also think, Jessica, you made the really good point about people not always realizing that they're caregivers, because it doesn't mean that you have to be doing it 24 hours a day, 7 days a week, right? It really is something that you do to help out somebody else in their journey in life, right? Whether it's and caregiving also is for young people, right? So moms and dads who are taking kids to school, who are making sure they stay alive, to be honest, right? We're trying to keep making sure that they're healthy and that they're eating healthy and doing other stuff, and also those who are helping elderly parents. And so, Rita, I want you to talk a little bit. You mentioned in your introduction this idea of the sandwich generation, those folks who are not only taking care of elderly parents, aunts, uncles, whoever, but also are caregiving, which is a form of caregiving, children. And what is the stress and kind of issue with that, which is why we call them the sandwich generation.
Yeah, this could be a whole separate webinar unto itself. But Honestly, 29%. Our recent research that AARP and the National Alliance of Caregiving released just in July showed that 29% of caregivers are sandwiched. And traditionally, when we talked about sandwich, and I've heard recently sandwich, panini, club sandwich, all of those things I think are applicable depending on where you are in the process. But one of the things that I think is really critical is having an understanding of who those individuals are. Traditionally, when we thought about sandwiched caregivers, we were thinking that the caregiver was 50 plus and the taking care of an older person and their child was, probably high school, maybe middle school. But what we're really seeing, particularly as more and more caregivers like Jessica are younger, they're under 50, and they are earlier in their career, and their children are younger. So they're taking care of an older adult, but they're also taking care of a newborn, or they're taking care of a toddler or a young school age child. And they're doing that while they're trying to work, while they're managing different challenges that they have in terms of really balancing the two. As I said, I was sandwiched and trying to figure out how to take care of an older adult, pay elder care, while also taking care of a newborn and pay childcare was very different, right? And it impacts you financially, it impacts you emotionally, and quite often it's women that are doing that, and they're doing it without a lot of support and understanding. I think the other thing I wanted to add into that sandwich caregiver conversation is that sometimes that sandwich caregiver is a grandparent. Sometimes it's an aunt that has taken on the role of taking care of a child because that child's parent isn't able to care for them. And so now they're dealing with the nuances of that relationship and taking care of an older adult in their life. And so it is very challenging and very difficult for these individuals to be able to navigate that.
If I may just add to that sandwich that Rita so eloquently described, and I don't know if this fits in as maybe the lettuce or a condiment or the meat that's in there if you eat meat, but youth caregivers. So, whomever it is that's being cared for, it's a network oftentimes. And, whether it's the child that's a part of that sandwich, right? That gets kind of swooped in to be a part of that caregiving network by default, that we tend to, not talk so much about. I think there's been more and more traction on it. Now, I know at the recent Alta Summit this year, there was a whole session on youth caregiving, and they had a whole youth caregiver segment that I understand was extremely impactful. So I think we need to make sure that we are recognizing the youth who are, these kids who are in K through 12 school, who are caregiving for parents and grandparents and aunties and uncles in this very taxing way too, and what that looks like for them, and when they aren't able to show up in their daily lives for sporting events or in their academics, that is not being seen as them just being delinquent, or that they don't care about their work.
I think Karen, you made a really good point. Not only about youth caregivers, it's not only caring for parents or grandparents. Sometimes they're caring for other siblings because the parents are caring for the elderly parents in the house. So you're right. There's this almost cross caregiving that is happening where you have middle school or high school age kids looking after younger kids because the parent, the parents are helping older generations. And so thinking about, I'm hoping that in this conversation, we hear that this role of caregiving is really wide and there's many people who can be caregivers. And I also want us to, and it's not reframed, but also think that like caregiving is also a wonderful thing, right? It brings generations to, it can bring generations together. It is showing, like as Jessica said, empathy and love for your family member or your neighbor or your community, right? Because we have folks who, particularly in the communities that we serve, it may not even be somebody they're related to, right? But they know that this elderly person needs some help and they assist. And so that is actually a beautiful and wonderful thing. What we have to, I think, what we're trying to talk about in this webinar is how do we make sure people are not burned out, that they're supported in ways, and that we're also not, I'm going to use the big word, the system, not making the system accountable to supporting people that need to be supported. And so I think that's also a thing that we need to talk about also. So let's talk about a little bit, we've kind of sidestepped it a little bit, but I think it's important for us to talk about who has normally been seen as caregivers, why, and then how do we support others in being caregivers, but also supporting the caregiver? So I don't know, Jessica, given that, you're actively in that role right now, can we talk about who has normally been seen as caregivers?
Such a good topic. This could be a whole webinar in itself too. But I think, historically, you look at even just the Black family structure. It is usually the Black woman, the oldest Black daughter who like steps in. That carries the weight of caregiving. Now, I'm an only child. I'll speak from my experience. I'm an only child, daughter of a single mom, and so there really was no one else to step in to care for my mom. So it was me. But one thing I realized as an individual that has always been type A, plan A, B, and C, all the vision boards, have my stuff together, what I realized is because people saw me as the leader, the person who can always handle it, the strong one, it was like, oh yeah, Jessica's got it. Jessica can handle it. We don't have to check in on her, right? And I think that happens a lot when it comes to caregiving. It's like the child that is, that is responsible and organized often steps up to do the heavy lifting. And then because it looks like things are easy or they have it together, we're often left out to dry, is what it feels like, right? And I'm not saying that that's not the case for some people, but I can speak for myself. It's like, even though on the outside things looked like things were okay, I was also drowning. And all I wanted was for someone to say, I see you, or how can I help you? Or can I drop this off? Or can I come sit with your mom? Right. And so just to like zoom out a little bit, I don't want to generalize, but what I'll say from my experience is oftentimes it's the people who can organize quickly, get things together, right? And seemingly have it all together. But what I would offer is for to support that family caregiver in a way that is tangible, right? That is practical, that looks like saying, I might not know all the things to do with your person, but here's what I can do. Or I have this set of time. I would love to be able to take some weight off your shoulder. Here are the things that I'm capable of doing in this hour of time, right? Or I don't have the time, but I'm going to send you groceries, right? Like things like that, because I can tell you that the family caregiver that is carrying the burden is likely just wanting for someone to say thank you and for someone just to show up for them, even though they might not necessarily articulate it. I also think that there is some onus on the family caregiver, right, to speak up and to say, here's what I need from you, even if they might say no, right? But I think that we have to participate in getting the help that we need. And sometimes that's just saying, here's my list of all the stuff. Who can help me with that? Or I don't know what I need, but I do need my people to check in on me, right? And so I think it's a both and here.
No, Jessica, I love that, and I think you got us, and we're gonna get there. But you got us to what I was gonna ask later on, which is like, what do people need? But it is a both end. It's people need to reach out, but also the caregiver themselves needs to be able to say, hey, I need some help here. But I think it's really important for us to stay on this kind of track of feeling like they have to do it on their own and feeling like they can't ask for help. And I will say, I was also trying to get us that, and the numbers, which are changing, but that usually women are most likely to be the caregivers in the family. One, because as you said, not only oldest daughter, but women have historically taken on more caretaking roles. That is changing, which is nice to see, but it is still, the evidence still shows that 80%, I think it's 80%, and that may be the wrong number, but the majority, let me use that instead of taking number, the majority of caregivers are still women, and it's still seen as a role for women. And so because that role has somewhat in just our society and our norms been kind of placed on women, that this is your role and this is what you not should do, but it in a way should do. How do we help caregivers to ask for help? Because I love Dr. Raquel Martin. I follow her on Instagram, and she has uh, this kind of campaign that's called "Burn the Cape," right? And it's basically about like not being the superwoman, asking for help, showing when you're drowning, saying, "Hey, I need some help." But we find that to be really hard. And I was wondering if the panel could talk about why do we find that to be hard, and how do we escape that kind of feeling the need to kind of suffer in silence?
I'll jump in on that one because I'm in the Burn the Cape Club myself, but it took me a long time to get there. I still keep it in the drawer from time to time when I need it, but it's one of those things where, and I remember having this conversation in the past with colleagues and friends of my own. We're asking people to take the cape off. We're asking people to ask for help, but oftentimes they don't ask for help because there's nobody around to help them. And so I think while it is very important to recognize where you may need help and try to, if there are individuals around, give them an idea, as Jessica said, very specific about what that is. But let's be honest, far too often there isn't anyone there. And so what happens is there's a challenge. If I'm a working caregiver and I'm really having a hard time balancing my work and my caregiving responsibilities, do I take the chance? Do I feel comfortable talking to my employer and admitting that I'm having some challenges? And are there some resources there? And so, what can happen? Employers can be more obvious in saying, you know what? I recognize that many of my employees, 60% and actually 70% of working age adults are family caregivers. And what we're seeing is that we need employers to be able to say and to offer resources and supports that are obvious and that are there, and to create a culture where that family caregiver can feel comfortable asking for help. I think another area that's really important, and Dr. Moss alluded to the program earlier, if we look at our faith-based communities, are we as a community saying, you know what, these individuals are doing some really hard things, and yes, while they're going to do it and we know that they are able to do it, what resources and supports are we giving them so that they don't even have to ask for help? It's really already right there. They just know it and see it. And so Dr. Fayron Epps has a very important, and we can drop that in the chat, program across the country now called Alter Dementia, where it is educating pastors and other members of the church, as well as caregivers themselves, to know what this is, to know what the challenges are, and to be able to create a community where the caregiver knows that there are going to be resources and supports for them that then enable that individual to feel okay asking for that help.
And actually, Rita, you got me right into the next question, which is, what are those challenges? Let's have a talk about some of the challenges, and then Dr. Moss, I want you to talk about your program also, and what you're doing in this kind of circular kind of like putting it all together. What are the challenges that caregivers are facing, and how is it that we can support them in those challenges? Because I want to enumerate what the challenges are so that folks can understand, because sometimes people may not even understand that that's the challenge, right? Yeah. Anybody can take it.
So I just want to jump in and talk a little bit when we talk about women, and women being the majority of caregivers. That is very much true, I think, across any condition that you can name that, the person that they're caring for is living with. But I also think part of the challenge with that is we miss our men, and we miss providing resources and reaching and meeting their needs. Because as hard as it is for women caregivers to speak up and raise their hand and say, I am a caregiver, or to identify with that title, I think it's probably more than doubly hard for men to step forward and say, caregiving. Who do they talk to? Who do they speak with about the challenges that they're having on the job? How do they identify others, right, who are in this same space with them? And then that comfort level of being able to share. And then depending on who it is that they're caring for adds another layer of complexity. I think for us as daughters or women, we can caregive for an aging mom, an aging dad. It's just a very different dynamic if I'm a son and I'm trying to caregive for a mother or a grandmother, right? For a lot of obvious reasons. So I just wanted to chime in with that piece.
No, Dr. Moss, I'm so happy you said that, because that literally was going to be my next question, was that even though women are the one that are the majority of caregivers, we can't forget that there are lots of men who are doing caregiving, and for them in particular, they become invisible in a way that is unfair to to helping them get supported, because people don't see men as caregivers. And so, Rita just made a really great points about, how, at the job, getting people time off. When we think about, in this country in particular, when we think about family medical leave, we don't really think about men, even though men should have paternity leave. We should give them paternity leave. They should have caregiving leave, but we always think much more about maternity leave and women, and not so much about the men, one, bonding with their newborn baby, but also who have caregiving and child rearing responsibilities. And so having a supportive policy and work culture that supports men being able to feel comfortable, because part of the research has shown that men don't feel comfortable. They feel like they've been punished for taking that time off, to feel comfortable and not punished for taking that time off to care for young children or for older adults. So thank you so much, Karen, for saying that, because that was literally my next question, to make sure that we don't forget the men who are doing, and there's lots of men who are doing lots of caregiving, and many of them are doing it in conjunction with their wives, right, or their partners, because sometimes it takes two people to help older parents, if both parents are around, because you got to think there's two sets of parents now, and possibly you're working with two sets of elderly parents, and so it requires more than one person to do that work. Jessica, were you going to say something? Or Rita, were you going to say something? Go ahead, Jessica.
I was going to jump in. I was going to try to connect the points, but I won't try to connect them. I'll just say the things I was going to say. Is one, I think there is power in, or there's a need to just normalize the conversation around care, especially as a younger caregiver. I was 26. One thing that I noticed is that, especially in the workplace, conversations were still focused on workers that were parents versus workers that were parents and also potentially caring for other adults. And so the more that I started caring more openly, it actually opened up the conversation for people to be like, oh, wow, I'm also a caregiver too. And I didn't realize we had these resources to do X, Y, and Z in our workplace. And so I think something that's really easy for everyone to do is to truly just start sharing our stories more and not be so afraid or like hiding behind the veil, because you'll likely find that there's likely someone else who has a similar experience who just needs you to give them permission to like articulate what they might need. And there's power in sharing of stories. I think the second thing I was going to say, you asked like, what are the challenges? And something that I can speak from my experience is that as a young growing professional that was also thrown into this caregiving responsibility, it's like I still wanted to be seen as competent. I wanted to be promoted in my job. I still had to work. There was no leaving, right? Like we have to pay for care. And so for me, in my millennial mind, it was like I have to burn the candle at both ends. Why? Because I still want opportunities. I still want promotions. I still want to be able to do X, Y, and Z thing in my like own trajectory on top of still try to show up for my mom, right? Even though I'm flying back and forth between Texas and Virginia every 2 weeks to meal prep, do appointments, and then go back for meetings at 9 a.m., right? Like there's something that when you're a caregiver, a switch turns on and you do some of the most unthinkable things, not because anyone's told you, but it's because you feel this obligation to make sure you are seen as competent and worthy of still being seen as someone who can do it all. Not that I'm saying that's like healthy, right? But that's just what happens. But then I think that connected to that is you're also carrying a number of burdens, one being financial, right? We don't talk about the cost of care enough. And the reality is, many of us can't afford $10,000 to $14,000 a month for our loved ones to be in long-term care facilities. Most people have a misunderstanding of what Medicaid actually covers or the quality of care you get from Medicaid. Most people don't have long-term care insurance to be able to pay for in-home care or, someone to take care of you should something happen. And so the financial burden hits you really hard, and oftentimes people are struggling silently to figure out, how are we going to make this work, protect our loved one's dignity, all the while still pay our bills, all the while still make sure I have money to invest so I have a life financially post caregiving, right? On top of, here's my connection point, just the mental well-being of caregivers, male, female, however you identify. We don't talk about the impact on our own just mental health, right? Having to watch our loved ones change or step into doing something so like out of the ordinary that we'd ever even expected, on top of now showing up to raise our kids, work, be a good friend, whatever it might be. We're often battling anxiety, high functioning anxiety, right? Depression, and a number of other things, but still showing up every day. And we're not talking about how we need to help people navigate through that too.
If I can just jump in, Jessica, well said. And what I heard is this challenge of or dynamic of who gets to be vulnerable even, right, in the workplace. So yes, you want to just scream from the inside out that I'm struggling, but then there is the what ifs. What's going to be the drawback of doing this? What's going to be the backlash? How's my career and how am I going to suffer as a result of being vulnerable in this way? So I think that's a whole other conversation. But Rita, you mentioned it. Jessica, you mentioned it as well. When we think about the challenges in being in the workplace and having access to resources and being able to share with others and even identify others who might be going through something similar that you are, I think is hugely important. And I just wanted to put a plug in for this program, and I guess I can do that. It's still in the research space at the moment, but this is a program that was developed through my research conducted. It was developed with and for Black caregivers of people living with dementia. Our goal is and has always been for the program to be eventually open to all racial and ethnic groups, and we also want it to be available for other types of caregivers as well. But Pair to Care is the name. And Pair to Care is a program that was co-designed. So myself as the researcher did not sit down and say, I think this would be nice for these caregivers to have. No, we had conversations with people who are currently caregiving, those who are former caregivers, meaning their loved ones already passed away because of their experience, and healthcare providers and community leaders. And we specifically wanted to capture the experience of lower socioeconomic status caregivers. So current and formers had to be considered lower socioeconomic status because we wanted the program to be able to meet the needs of folks who fall in that even more so vulnerable categories as well. And we received some funding for it and was able to conduct the initial testing. But just in short, what Peer to Care is a peer support program where we connect caregivers with a mentor, a former caregiver, an experienced caregiver for 6 months. We say just get together for 6 months. No in-person connection because we were told that support groups are great, but I'm caring for my loved one, I can't get out to be at 6 o'clock on a Wednesday night at the community center or wherever. And it's connecting in ways that are convenient to them, to the dyad. So emails, text messages, phone calls, video calls, on a flexible cadence, whatever they decide. And we measure things like anxiety, depression, Jessica, as you were mentioning, quality of life and all that stuff in the mentee, who's the person who's currently caregiving. We ended up including an interview at the end of this initial pilot, where we did an interview not just with the mentee but with the mentor as well, because we started to hear these stories about how these former caregivers, who, by the way, we typically, once caregiving is done, if their loved one passes away, as a society we tend to hang them out to dry. We say, okay, time's up, go back to work now, do whatever you were doing before, right? So all those other things that Jessica mentioned about the challenges in work, and maybe you're not progressing up that ladder or that scale or promotion in the way that your colleagues might be, who may not have these types of responsibilities, but you're expected to get back on that horse and you're going to be measured by that very same yardstick. So unfair, right? And so we're hoping that the good things that we've seen in our pilot, people coming to the study quickly, no one leaving voluntarily, which is unheard of, right? Particularly in the Black community, that will continue as we expand. Our plan is to go across the Midwest. We just resubmitted an R01 level study to the NIA for additional funding to continue to test peer-to-care, but also are exploring ways to see how can we get this program into the hands of people that need it sooner rather than later, because we know research takes time, but realizing that also employee assistance programs, and I just actually participated in a weekend-long workshop that was helping me to strategically think about how employee assistance programs need to have programs like peer-to-care in it, where we can identify people and folks can be referred to for this type of support. And the last thing I'll say is, things like counseling, seeing your healthcare provider, they're great and they have their place. But as we were told in our study that led to peer-to-care, was that caregivers know where to go for healthcare. They know where to go for counseling, but they wanted to be connected with somebody who had the lived experience, somebody who's walked the walk, and that they didn't have to hide behind the embarrassment or judgment of saying that this is my fill in the blank person that I'm caring for, but I'm tired and I don't want to do this anymore. Do you know that they don't even know who I am anymore? And so they didn't want to have to explain that to the person that they're talking to, and peer-to-care is allowing them to do just that. So I'll pause, and I apologize for the long piece.
No, don't apologize. That's amazing. And these are the kind of resources that we want to share with the communities on this webinar and beyond, because it's important for people to know, one, evidence-based, what's working, right? And what you're showing in your pilot is that it's working, but also this really important point that I think you just made about having people in similar experiences, because caregiving is hard. And you're right. People don't, you know, especially in cases of dementia, or when people have, end stage, cancer or other diagnoses. One, you're watching a loved one possibly pass away, which is, heartbreaking themselves, but also the caregiving that goes with that is really hard. And there's some days I know that people just like, I can't do this anymore. And there's other people who may not be in that, who have not had that experience, who will say something like, well, that's selfish. How can you not want to do that anymore? That's your mom, that's your sister, that's your daughter, that's your brother, that's your uncle, and don't understand how difficult it is day in and day out to 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 provide care, and not only mentally but physically. When you have somebody who is bound to bed, turning them over, helping them go to the bathroom, changing diapers, all this other stuff. And I know this not because I did it, but I know I watched my uncle do it with my grandmother. And I remember, we were lucky that we had aunts and we had grandchildren, we had other people that did try to give him a break, but still he was the one that was with my grandmother before she passed most of the time. And we could see the burden on him, and we tried our best, cooking meals, exactly what Jessica was saying. But the rest of us also worked. He happened to be retired, and so he was able to do it. But he was there every day. He was the one that was lifting her. That was physically taxing on him, not only mentally taxing on him. before she passed away. And so I think people don't understand, and sometimes not knowing, kind of what somebody is going through in their day to day, because you just see them, you're like, oh, Jessica's a great daughter, but what she's going through every day trying to help the parent is difficult, and people need that help. So I'm so happy that you're doing this research. I'm so happy that you're going to get this out there, and I would love, when you're ready to share it wider, to please share it so we can share it with our Urban League affiliates and the work that they're doing with many community partners. I think it's a really important thing. And this peer model, I think, is a really important model. Rita, were you going to say something? I thought I saw you come off of
Yeah,
mute.
no, I mean, and it's just probably a connection point between all that's been shared, is that I think it shows that it's really critical that any supports that are put in place for family caregivers really need to be targeted to these different groups. There's not just one type of family caregiver. So recognizing that they're male caregivers, like how do they learn in a way that is different than a female caregiver may learn? What are the needs of someone that is working versus somebody that may be at home? Just really recognizing the different elements, and that you hear it all the time. For every caregiver you've seen exactly one caregiver. And so not just grouping these solutions all into one place. And I think that's important from a policy perspective as well. And that's where research really comes into play, is making sure that we're really being able to understand what the various needs of the different communities of caregivers are.
Thank you so much, Rita. And I want to talk about policy solutions. I want to talk about how do we surround caregivers in a way. We talked about helping how places of worship can help caregivers in learning about some of the things they need. But what are the other community assets or community resources that can support and help caregivers in their journey? And I think a point in part that Dr. Moss, you made, is not only the journey when they're caregiving, but also after the caregiving is quote unquote over. I think that's a really important aspect that I had actually not really thought about. Is this this after time? How do you support that person in the after time? So anybody can take that, but interesting to think about those kind of resources that are in the community.
I think you can find, there are a dearth of resources. I'm not going to come on and say there's resources everywhere, because honestly, that isn't the case. I think that there are examples of places where you can go to get some support. The issue is that people don't know about them, right? And so, area agencies on aging, whenever I say that word, people are like, who, what, where do I find that, right? And honestly, depending on what community you live in, they might not look the same, because I'll tell you, my area agency on aging is not the same area agency on aging in other counties in Maryland. And that's unfortunate. And I wouldn't have known that if I didn't even work in the field, right? I think that we are seeing more faith-based communities recognizing a need around this. One area that I think is really critical is the area of respite. And what respite is really a program, and they vary from community to community, from provider to provider, but understanding that there are some resources that will allow you to step away from your situation for a moment, right? And that moment could be an hour to actually go get grocery shopping done. It could be 2 hours to take a nap, or it could be a weekend where someone comes in, or you place the person that you're caring for in a facility. And that, that has its own set of challenges, but that there are resources that are there. In terms of area agency on aging, there's also something called ADRCs, and these as well, they're aging and disability resource centers that can be found in your community. And a place to go for that, you can either call 211 in your area. You dial 211 and you're able to ask questions around where can I get some of these supports. And then you're also able to go to eldercare.gov, and that is another place where you can put in your zip code, and either online or talk to somebody typically that can provide some resources in your area as well.
I appreciate Rita for sharing those just really clear resources. But can I also just elevate as a younger family caregiver? Forget the younger, but as a family caregiver, the realities of even finding those really simple places to start is one, just being so overwhelmed that you don't even have time to follow up on a link that someone or a phone number that someone shares with you, right? But then also, what I've also experienced is even when you ask, right, people will just give you the resource, but then not follow up to help you actually get said resource. And so maybe what I'm offering for anyone on the call who is helping people in our community, it's like, sure, share the thing. And then the next step is how can I help you make sure you get this resource and support? Because if a family caregiver is like, I don't know where to start and overwhelmed, they need more than just the information, right? And so part of who can help or how do we improve, it's like we've got to hold hands with our people in our communities so that they're not abandoned even once they ask for help. And I see that too often. I think the other thing to name is um, as a family caregiver or as someone who is now supporting a family member, you have a responsibility to be overly communicative and overly curious and asking all the questions when you go visit that medical provider. Because one thing you will realize is that they're not offering up those resources proactively, right? And oftentimes, unless you ask specifically, what are local resources or supports in our area for my person, you might not get them. And so for anyone who's also supporting families, it's like you have to put on your advocacy hat. You are their mouth, eyes, and ears, and speak up and not assume that the doctor or whomever is actually going to look out for you. You really have to get in the driver's seat so that you can get all the little things that maybe you didn't even know that you needed, right? Until you asked for them. So I would just offer that in addition to those really practical resources.
I love that. I love both of what both of you just shared. I also from one healthcare provider to another, want to call out our healthcare providers and say, our healthcare systems in general need to be doing a better job of identifying who caregivers are. It needs to be a standard question when any of us on this call, or anyone for that matter, right? So, whether they look like your typical caregiver demographic or not, we should be asked, are you the caregiver for anyone, period, right? Because now we're hearing more of, um, do you feel safe at home, which is great. Have you struggled with any anxiety, or have you been feeling depressed? Those are great, but how about let's get to the root of why I might be feeling depressed or why I might be feeling anxious. And so even just finding out if someone is a caregiver, that can open a door, right? Because that person might just feel a little bit more empowered to say yes, and you know what, I'm struggling, and then resources can be provided. And Jessica, I think you hit the nail on the head. This ability to follow up is crucial. I'll tell a quick story. When I was in my doctoral program and doing work and connecting in the community, we had a PACE center, PACE. It's the acronym for, help me here, Care for the Elderly. It's an adult day program. It's federally funded to keep folks living, adults 55 years and older living longer in their homes, right? So to avoid having to go into nursing home. It's not dementia specific or any disease specific, but it's a wonderful model. So look it up if you haven't. PACE, federally funded program for all inclusive care of the elderly. I got it. Yay. And so I met a young lady, I call her a young lady in the community. She was an older adult who was caring for her husband who was living with dementia. And she happened to be a bit older than he was and doing it all alone, and having the neighbor's son come in to help with baths and all of that, and paying, tipping him, right, through their social security. Like, not a good scenario, right? And her to be doing it all alone. And we had Pace come to the area, and I said to her, I said, you should really look into this Pace program, right? Well, like Jessica said, good luck. She's busy. She's not going to have time to do that. And so I asked her if it would be okay, because I knew the person who was responsible for intake. I said, is it okay if I pass on your information? And of course, I'm not even doing this as a healthcare provider. I'm doing this as a concerned citizen in the community. And she agreed. They reached out to her. And I will tell you, the next time I heard this lady's voice on the phone, she had actually reached out to me, and she was asking me, she told me she was ironing and watching the stories, and they came and they picked up her husband and took him on the bus for the day. And sometimes they pick her up and take her to have lunch with him. And I honestly didn't recognize the person I was talking to. She was asking me, how are your kids? I didn't even realize she knew I had kids. She was just such a different person. And she was so grateful for being able to receive this help that they were able to qualify for. And it was, I tell that story all the time because it's, I think, a good example of not just saying, here's the resource, but also following up. Or can I have them reach out to you? Can I connect you? Because we know how busy caregivers are, and most times they're drowning on a good day. So I just wanted to share that story real quick.
I love both of that. And I also want us to couch this larger caregiving conversation, because it's wonderful to have the PACE program, but also thinking about folks who have young kids, right? That, like, there's not necessarily maybe a similar program, but the aunties and the uncles and the cousins and the godmoms can take a time, for to say, I'm going to take the baby for a hour or 2 hours, or I'm going to take them. I do that with my nieces and nephews when they're around. If I can, I'll say, okay, I'm going to take them to the movie so you all can get, 2 hours to take a shower. Sometimes young moms and young dads don't even have time to take a shower. They're seesawing between the kids, and neither one of them haven't had a chance to have some breakfast. It's like, my favorite question to ask young parents is like, have you eaten yet? And most of the time they'll tell you no. And you're like, well, can I get you something? Or can I hold the baby so you can go and, put a yogurt in your mouth or something? And so it's important for us to think about all the different types of caregivers that are around and that need help. And well, I'm going to say lucky, even though we know it's probably not what it should be, to have some systems in place for folks who are aging, but we cannot also forget about those who are taking care of young kids, because we all know that that's a 24 hours, 7 days a week job. Not only the job itself, but just being able to think through, keeping your, just, the safety of your children. So that's really important. I wanted to add another resource, because I think Rita gave us great resources, and so did Jessica, and so did Dr. Moss. Departments of Public Health also have programs for helping particularly elderly and, young folks, and it's going back to the policy conversation, thinking about how we think about schooling. I happen to be in New York City. One of the things that New York City did was, 3K, being able to put kids in school earlier, take some time off of caregiving, because the kids are allowed to go to school even if it's for half a day, gives parents some time to look for a job, work at their job, or just get a break. And so I think policy, we've talked a lot about policy here, but policy and the not only big P policy, federal policy, state and local policy, but workplace policies are really important for supporting caregivers and allowing them the flexibility to be a caregiver, but also still succeed in their chosen field. And I think Jessica's real big point about that is an important one about workplace. Go ahead, Jessica.
I was going to say, I often say I was only able to be the caregiver that I was and am to my mom because of my workplace. We had paid family leave, right? And so when I took FMLA, that was paid for 10 whole weeks, right? Like, you get the 6 weeks paid, and then my job offered an extra 4 paid weeks. That's not normal. Like, not everyone is guaranteed paid family leave, whether it's for a child or caring for a loved one, right? I had an empathetic manager, right? Even if the system of your job is awful, you as a manager, and even when I became a team manager and team leader, it's like I led by example, because I knew that people needed to see someone doing it to give them permission to show up as their full authentic selves. So an empathetic and curious manager. I also took advantage of the flexible work schedule. This is a different time since everybody's been told to come back to work. However, right, like I was able to flex when it was time for doctor's appointments or, my caregiver left. And so I do think the workplace plays such a critical role in both the formal policies as well as how we train the people who support the folks showing up to work every day. Like, do not underestimate the power of creating a supportive environment, because as a caregiver, no matter who you're caring for, you are not a burden. You are not in the way. You are not less than. You just need the supports to be able to show up and thrive. And in fact, the thing that I say all the time is that I'm a super employee. Why? Because as a caregiver, I can multitask with the best of them. Okay. I also get my work done in a more efficient way. And so you want to keep those people, retain that talent. And when you think about and prioritize caregivers, you're actually creating longevity in your workplace system. So I'll get off that soapbox, but I believe that the greatest policies actually need to happen in the workplace so that people can afford to care, continue to care, and be able to thrive both professionally and personally.
Fantastic. So I'm actually, Dr. Moss. Well, go ahead, Dr. Moss. We got 3 minutes and there's like 4 questions, but
Oh my goodness.
go for it.
I'm just going to say, preach, Jessica. And there's a couple more resources. The Alzheimer's Association or associations, also Caring Kind, which I think you have in New York City there. And then locally here, there's in the Columbus, Ohio area, there's an organization called the African American Alzheimer's and Wellness Association. This organization has a national reach, and it's not exclusive just to African Americans. So I will put that link in the chat as well.
Yes, and so I will say a couple of things. I think you all can see the question and answer, but you may not be able to. Dr. Ethelyn Gibson has actually left a lot of resources for the Alzheimer's Association, for a hotline to talk to folks who have an MSW, for all sorts of other things. And we will collect those and make sure we put them with the webinar so people will have them. But Ms. Jackson has asked a couple of questions that I want to make sure that we talk about, and I'm going to try to get them all in kind of one. So Phyllis, I'm going to try. One is, how do you help people prepare to be caregivers? It's a really good point that she asked in her question. How do people plan ahead? Because at some point, she's right, all of us may have to become caregivers. And the second question, and Jessica, you may be able to answer this one, is there any resources specifically for people who are doing long distance caregiving?
I'm going to jump in on that first one real quick around planning for care. I think this is a critical conversation. We are not having conversations as families to talk about what care as we age looks like. In order to age with dignity, we have to have these conversations. I think oftentimes it's taboo. We don't want to think about becoming ill. We don't want to think about potentially becoming incapacitated. We go straight to the end. We don't even talk about the steps that get to that point. And so we have to come together and do better planning for our long-term care around finances, around what our healthcare choices are going to be, and around where we want to live. Because if we're not going to talk to each other ahead of time and have a plan that everybody's on board for, you might think your older daughter is going to be the one to care for you, but she may not have the ability to do that. And have you talked to her about what that looks like? And so it's very critical that we have these conversations and we put plans in place for our families that make sense for our families, so that those decisions are not being made in a crisis situation.
Fantastic. Jessica.
Ditto, all that Rita said. To the long distance caregiver question, I can't think of a specific resource, but the thing that I'll offer is get your community or your circle in place now, right? Before you even start operating as a long distance caregiver, because it is the people who will be on the ground when you aren't there that'll have their eyes on your loved one, that might be able to do runs to the pharmacy, doctor's appointments, whatever it might be. But you need a circle of support, whether it's 1 to 3 other people that can essentially be your eyes and ears when you're not there. I think the other thing is to, when you're a long distance caregiver, those documents and your foundation matter even more because you're often doing things from afar. So power of attorney, right? Being able to make decisions on behalf of your person because you're often calling or emailing or doing things not from there, that location where your person is. And then finally, I think the last thing, which seems so simple, but it is to actually communicate and to share that you are operating as a long distance caregiver. Because the more people know that that is your reality, the more opportunity you give people to show up and to help you in that time of need.
And if I
Fantastic.
can just, if I
Yes,
can
I'm
just
gonna give you
add
the
real,
last word. Go for it, Dr. Moss.
just really quickly, our distance caregivers need to make sure that they are actually seeing themselves as caregivers. So being a distance caregiver doesn't lessen, right? Because you probably need more time off from work, even, right, to make those, to travel wherever it is you need to travel. And even if your loved one is in an institution in your area or not, you're still a caregiver. I think a lot of people think, because they're institutionalized, I'm not a caregiver anymore. And I think figuring out ways, because family members are oftentimes across the country and maybe even across the world, figuring out systems for communication, communication of healthcare, doctor's visits, updates, that sort of stuff, change in documents, identifying, like Rita said, who that person is that will be the decision maker, who's going to be the lead communicator. I think all helps with reducing the stress and burden, especially when you're at a distance.
Rita, would you like to say one last thing before we end?
No.
Okay, perfect. I just want to thank everybody. We're above time. I know we could have kept on going for another hour. I love these calls. This is how it always happens. We have so much more to say. Thank you so much to my distinguished guests. I'm honored that you all took the time to do this. I hope everybody learned a lot and got a lot of tips. And we will make sure that there was more resources that was being sent in as we were talking. So I will make sure that all of those get put into the email and the YouTube about this. So thank you so much, everybody. This ends the webinar. Have a wonderful day and happy holidays, since we probably won't see you all again until December. Thank you all so much. Have a great day. Bye-bye.